Hello, my name is Gloria Macías Calderón. My topic is on DOCK2 deficient in patients with early-onset invasive infection. Definition. It is a rare primary combined T and B cell immunodeficiency characterized by invasive and recurrent early-onset viral and bacterial infection associated with immunopopeia and functional T and B cell defect or antibody response and thrombocytopenia depending on the type of infection agent. The variable clinical manifestation include many recurrent pneumonia, bronchiolitis, otitis media, meningoencephalitis, colitis.
Hello everyone, and thank you for viewing my presentation today on inherited bone marrow failure, genetic testing, and advantages of early diagnosis. My disclosures: I am a molecular geneticist at Prevention Genetics. My name is Michael Chica. I've been a molecular geneticist at Prevention Genetics for over 10 years. I specialize in developing genetic tests for blood disorders. I've signed out many reports for patients with different hematologic conditions. I've probably communicated directly with some of you regarding your patients. Here, we are looking at a list of common blood disorders for which we test. We are also looking at an electron micrograph of a red blood cell, a platelet, and a white blood cell, three main cell or cell-like entities found in blood. When red blood cells, neutrophils, or platelets are not functioning properly, or their concentrations in blood are too high or too low, patients may experience symptoms of different blood conditions, such as von Willebrand disease, thrombocytopenias, neutropenias, or anemias. These symptoms may be an indication of a broader condition involving bone marrow failure or a hematologic malignancy. There are several main objectives on which I will focus.
Application in nursing. The application of molymorphisms are numerous, both in basic research and in clinical application. The comparison with DNA from various biological remains, such as blood, semen, saliva. Libraries they are used for clinical purposes, such as the identification of biopsy, the possibility of transplant, the genetic instability of tumor, etc. There can also be used medical for process, especially in the prevention of complex disease.
In Houston, on September the 21st, 1971, a baby boy is delivered by cesarean section under completely germ-free conditions. Born without a working immune system, he is immediately placed inside a protective plastic chamber. It will become his home for the next 12 years.
In the mother's words, can you keep him safe and away from the germs? And we said, yes, we can.
The story of David, the boy who lives in a bubble, has been told all over the world.
His life would be portrayed in the media as a triumph of technology over a fatal genetic disease. But behind the scenes, it would be clouded by argument and controversy.
When I first saw David, I was deeply disturbed by the fact that he was in this laboratory tube. I felt like I was visiting a rat in a cage. Almost certainly the first human guinea pig in history to live their entire lives in a laboratory capsule.
For the first time, using rare intimate footage and contributions from his mother and medical team, we tell the real story of David Vetter, the boy in the bubble.
and cons. Pros. There are studies, in this case in a group of children, that normalization of cell function and clinical improvement result we identified violet mutation in the psychokinesis gene dedicator DOCK2. Cons. There are studies carried out in with two patients died in infancy after allogenic hematopoietic stem cell transplantation. In some cases, there are chronic complications.
So looking at the immune system and dysfunctions, I'll talk a little bit about the deficiencies that can happen. So an immunodeficiency can either be primary or congenital, and of those that includes your B lymphocyte deficiencies, or you can have a T lymphocyte deficiencies. There can be combined deficiencies, which is a B cell and T cells. There can be complement deficiencies, or there can be problems with the phagocytes. There can be secondary immunodeficiencies, and generally they are medically induced, meaning that a person has another condition that's causing the immune system not to work properly. So it could be, say, cancer, a leukemia, or it could be medications such as an immunosuppressant therapy that would cause a deficiency in the immune system. And of course, then there is HIV/AIDS that is considered a secondary immunodeficiency as well. Primary is often congenital, where a child is born with a problem in the way the body builds either B cells or T cells or both. And so it's diagnosed often in infancy or in childhood, because kids are the ones that are the cesspools. They are exposed to more, as well as their immune system, if it's not working right, would have recurrence of diseases. So the symptoms of someone having an immunodeficiency would be recurrent severe infections. So generally preschool kids or school-age kids have between 6 to 12 infections a year. Adults, you'd see more like 2 to 4 infections a year. And most of these infections aren't severe, but if someone has a primary or congenital immunodeficiency, you'll see that they have severe otitis media or ear infections, pneumonias, sinusitis.
This is applied in Ecuador. The Ecuadorian National Registry of Chromosome Alteration and Polymorphism provides a baseline to better understand chromosomes abnormalities in Ecuador, and therefore their clinical management, and afterwards this date will guide public policies maker to promote and financially support cytogenetics and genetic testing.
One of the diseases categories that we are very interested in is called severe combined immune deficiency, which is really a variety of disorders. Easily up to 20 different genetic defects could lead to this disorder, but it is what the bubble boy had way back 20-some years ago, and it leads to a profound vulnerability to infections. These children would all die by age 1 to 2 years typically, with rare exceptions, and with our reduced intensity therapy, we are able to offer transplantation from a wide variety of sources. Different options and technologies are readily available.
Conclusion. Autosomal recessive DOCK2 deficient is a new medallion disorder with pleiotropic defect of hematopoietic and non-hematopoietic immunity. Children with clinical feature of combined immunodeficient, especially early-onset invasive infection, may have this condition.
Like any rather complicated machine, and the immune system consists of quite a lot of different cells and molecules, and they have to interact in various ways, things can go wrong sometimes in the immune response, and you can end up with immunodeficiency, a deficient immune response. Sometimes this is due to external agents, and in that case, we refer to secondary immunodeficiency. But now we're going to discuss primary immunodeficiency. So primary immunodeficiency is defective immunity that is due to either an inherited or an acquired gene defect. The distribution of cellular primary immunodeficiency defects is that around about half of them are caused by defects in B cells and therefore in antibody production. Around about 20% of primary immunodeficiency defects are combined T and B cell defects. Approximately 20% affect the phagocytic cells. And around about 10% affect just the T cells without affecting other parts of the immune response. The consequences of primary immunodeficiency are that we see opportunistic infections. These are infections that most of us, most of the time, are not really troubled by. We will deal with them perfectly adequately. But in patients with primary immunodeficiency,
Thank you.